welcome to Dying in Grace, the show designed to explore all aspects of living and dying well, death and dying, so that we can integrate death back into the normal life cycle, so that we befriend death and we can cope with it as part of our everyday lives. My name is Arlene Stepputat, and each week I like to bring one of our community experts to share a unique perspective, experience, or background. And this week I'm delighted to have with us Dr. Michael Kearney. Dr. Kearney is the medical director of Serenity House and also was a palliative and hospice care doctor at Cottage Hospital. And you're also an author. So I'm so grateful. And I can say my friend too. So thank you so much for being here.
Thank you for having me.
Yeah. So could you tell us a little bit about how did you become a hospice doctor? I mean, that's not a field everybody jumps into.
Well, I can. Yeah, there's a little story around that. And I'll give you the short version. But I really kind of became interested in hospice medicine long before it was recognized as a medical specialty. As a medical student, I became a little disillusioned with medicine. I was thinking of leaving medicine. I was very interested in English and poetry and movies, thinking maybe about an alternate career in the humanities. And just before I made any big decision around that, I talked to a mentor figure of mine at the time. And he said, listen to me. And then he said, look, before you leave medicine, I suggest you visit this place in London called St. Christopher's Hospice. And he said, it's a place of healing. And there was just something about that phrase, when I heard the phrase, a place of healing, that it just somehow resonated for me. And I was curious, and so I attended a 1-week training there, and I just loved what I saw. I was deeply moved, deeply affected. I kind of felt I was meeting some of the most real people I'd ever met, people who were close to the end of their lives. There was just sort of a stark honesty. And I was just so impressed with what was happening when they were cared for, and when they were the center of attention, and when their pain was taken away, and when the focus moved from cure to really doing everything possible to improve quality of life, and how people just blossomed in that environment. And so at the end of that time, I met with Cicely Saunders, who's the medical director at that time of St. Christopher's, the pioneer, the modern hospice movement. And I said to her, I want to work here. And she said, well, if you do, go back, finish your studies, and then you need to either do internal medicine or family medicine. And when you're through with all of that, come back to us. And so I wasn't very happy to hear that, but I was willing to do that if it allowed me to get back there. So I did that. I did internal medicine and went back and worked at St. Christopher's, and was lucky enough to work with Cicely Saunders for many years.
And for people who are not aware, as you mentioned, she was the mother of the modern day hospice movement, and at that time it wasn't even part in the United States. This was just what are we talking, the 60s?
This is in the 60s. This is in the early 60s.
So this was really truly pioneering, because as you said, death was cure-oriented and the antithesis of medicine, right? If you die, you're a failure, kind of thing.
And just to a little bit on the history, hospice and the word hospice has been around for a long time, and a long time before Cicely Saunders and St. Christopher's. It's around in the Middle Ages in France, and then kind of revived in the late 1800s by the Irish Sisters of Charity, and they started Our Lady's Hospice in Dublin. That was about in 1869. Their patients were patients who were being rejected from the hospitals who only wanted to take people with curative conditions. So it became a home for the incurables. And I've seen the list of the first patients they admitted, and there were patients with typhus and cholera and TB, the big infectious diseases. Anyway, they went from there to London and opened St. Joseph's Hospice. That's where Cicely Saunders started working as a nurse. She hurt her back, and she retrained as a social worker. And she was so impressed at the care she saw at St. Joseph's that she really wanted to bring what she saw as really wonderful nursing care together with state-of-the-art medicine, social work, chaplaincy, research, and that really became St. Christopher's Hospice. And as you say, it was the first, kind of the flagship of the modern hospice movement. And it opened its doors in 1967, and around the same time as Elizabeth Kubler-Ross was doing her work here, and she was a friend of Cicely Saunders. And of course, her emphasis was more on the psychological aspect of approaching death and grief. But what Cicely Saunders really brought was the best of modern medicine to the bedside of those with kind of advanced and terminal illness, and she also really brought it back into medicine, from the peripheries, from the edges. And of course, it's developed from there. Palliative care has developed from there. It's become a medical specialty in many countries. Almost every acute hospital in North America now has a palliative care consultation service, as we do here in Cottage Hospital.
Yeah, it's amazing, and also the benefit of hospice, which is, not well understood. Again, because we're so afraid of death, and we're very blessed in our community to have so many resources to treat us, including Serenity House, which you operate. And
we're very lucky in this community to have Serenity House and Sarah House.
Yes, Sarah House as well. And actually we had Paloma, who runs Sarah House, as a guest at another time and talked about that as well. And somehow in all the work of a doctor, you managed to honor that aspect of yourselves that was called to poetry and humanities, because you found time to write, and which astounds me. And I read Mortally Wounded such a long time ago, but it was just so striking about how you allow the patients to inform you in their care in a whole variety of ways that are often dismissed, like dreams and those kinds of things. It's just amazing. So how do you find time for yourself to write, for instance? How do you manage that after a full day at the hospital or at Serenity House? Where do you find the time to do that for yourself?
Well, I think I find time because I really love it, and it's been, when I look back, I think it's probably given space for that part of me that didn't go into the humanities, as you say, because I've loved to bring in poetry into my work and stories, as well as philosophy and psychology and medicine, of course. And my first two books, Mortally Wounded and A Place of Healing, as you say, were really about kind of discovering a whole other side of medicine, which isn't so much about what we do for our patients, but about the kind of innate healing potential every individual has within them. Not just for physical healing, but for psychological and emotional and spiritual healing. And so, Mortally Wounded is about working with through image work and through imagery as a way of accessing that innate healing potential. And then A Place of Healing is really about listening to the dreams of our patients and seeing that dreams are really that innate healing potential sort of coming forward. And many people in this community may recently have had the opportunity of attending a talk by a Dr. Christopher Kerr, who was here for Visiting Nurse in Hospice, their kind of annual community teaching forum, and he was talking about the dreams of the dying and how they just sat down and asked people, do you dream? What do you dream about? And found that most people do dream close to the end of life, and it's often dreams of loved ones who are coming to visit, and they describe it as incredibly vivid and incredibly real, and almost invariably find it deeply consoling, sometimes taking away the fear of death.
And yet, you know, as you talk about that, I wonder, and I know there's been some movements with like Dr. Naomi Rachel Raymond, but I think of medical school, and certainly not a physician, but I think of all the things and all the disciplines and all the information and all the thrust of stuff, and even my own experience in the medical community, I don't really feel like my doctors have much time for me, much less to sit down and listen. You know, what's a visit, 15 minutes or something like that. You're lucky if you can get your symptoms out and they give you a treatment and off you go, not like the holistic approach to, you know, to do that. So did you think you learned that from being with Dr. Sanders, that to embrace the whole person in your work? Because, you know, I think it's interesting that a part of you was disenchanted with kind of traditional medicine early on, like a part of your soul, if you will, really knew, I have to find a way to put all of me into it so I can meet all of them. And I think that's beautiful. But working with the dying, and you've been at it for many, many years now, how did you manage? I mean, what tools did you use to keep yourself balanced? You know, what did you have tools that you used?
Yeah, I think I did, and I think writing was one of those. You know, just to kind of come back to your point, if I may, about, you know, doctors having time or not having time. I mean, I think part of that is just realism, you know, and the kind of pressures we as doctors, and I think say the same for my nurse colleagues, and just so many in healthcare are really struggling with just the sheer demand and the increasing kind of load of bureaucracy that's come with healthcare.
Yes.
So it really is a struggle. But what I wanted to say was that what I really learned from Cicely Saunders was she talked about how the real presence of another person is a place of security. The real presence of another person. So she really emphasized in her teaching of us junior doctors when we were working with her that who you are matters to your patients, not just what you know and what you do. Because medical school, and indeed most postgraduate medical training and specialism, it really kind of emphasizes the knowledge and the skills aspect, but doesn't so much value the personhood of the individual physician. And somehow that gets translated into valuing the whole person in front of you and having a vision that doesn't just focus in a very reductive way on the disease or on the symptoms of the disease, but is really kind of seeing that, you know, my perhaps primary, part of my primary you know, task here is to connect with the person that I'm meeting with. And that doesn't have to take a lot of time. That's one point. And the second point is that it really brought home to me, and another teacher I was very influenced at the time was Michael Bayland, who's a psychoanalyst who worked at the Tavistock Clinic, who started groups called the Bayland groups for doctors, which were kind of self-care groups, again, back in the 60s. But he had this phrase, we are the medicine. That we as physicians, but this goes for everybody who's a caregiver to somebody else, the quality of your life, the quality of your presence is what you bring to the other person. So the question becomes, what is the quality of your life? Because that's the quality of your presence.
Right, and you can't mask it even though you think you can. You know, you can put on that show and no one's really fooled.
No one's really fooled.
But you kind of go through the motions. You know? And we do that a lot. I mean, I think authenticity is something that we yearn for in society. We're not seeing that. You know, we
Sure.
see posturing, we don't see hearts so much.
Sure. And that's it. You know, one of the very first patients that Cicely Saunders worked with and who became kind of one of the kind of her guiding mentors in opening St. Christopher's was a young Polish man who was dying of cancer and who said to her, "I only want what's in your mind and in your heart." Mm-hmm. She'd asked him, "What can I do for you?" This was days before he died. "I only want what's in your mind and in your heart." And she emphasized just the heart aspect of medicine, mm-hmm. you know, and our patients, those that we care for who are sick, really need us to be there with our hearts. And just the power of kindness, and kindness as medicine, very mm-hmm. powerful.
And I know that just from knowing you and being a student of yours, I know that mindfulness has played a role in caring for yourself, but that led you to discover something else about yourself in the profession. So because again, how do you sustain yourself, and especially what you're sharing, you know, letting my full heart show mm-hmm. 8-10 hours a day, 12 hours, whatever it is, to a wide variety of people whose hearts are breaking. The family's hearts are breaking. Mm-hmm. Often the family have a harder time than the patient, although there's people that are afraid. I mean, everyone has their story. So, you know, I don't think that people think much about self-care for doctors. I mean, you know, my doctor's supposed to take care of me. I don't really know what they do for them. So with your heart open all that time, talk about what happened.
Well, what happened was, I think it was back in 2000, probably 2007 going into 2008, I was invited by a colleague up at UCSF who was editing a series of articles on the end of life for JAMA, the Journal of the American Medical Association. And he asked me, would I be interested in you know, inviting some colleagues to work with me on an article on self-care for clinicians, or specifically that article for physicians working at the end of life. And I said yes, and that became a kind of a one-year project with 4 wonderful colleagues. And we came up with our article. And the kind of thrust of our article is we kind of describe very briefly the different occupational stress syndromes. Very briefly, they're burnout, which everybody knows about. The second one, which is less commonly known about, is compassion fatigue, but which really is shorthand for vicarious traumatization. Mm-hmm. And that's what you're describing when you talk about being present to somebody in an open-hearted way. The toll that can take in terms of secondary trauma over time especially. And the third one is called moral distress syndrome, or moral injury. And that is where we're working in a system where we have an inner sense of what we want to do, the best care we want to offer our patients. But we're constrained by our environment, by the external circumstances, from following through on our deep inner sense of what the right thing to do is. And that creates a tension and a strain and a stress that has been termed moral distress in the nursing literature. And I'm now seeing a lot of interest in the medical literature in the whole idea of moral injury. So all of those can take a toll. You know, some of them are more environmental based, some of them are more about the impact they have on our psyche. And so we describe that in the first part of the article, and then in the second part of the article, we come up with strategies for mitigating, as in preventing, burnout, because burnout is the common endpoint of all the different occupational stress syndromes. And we also come up with, strategies for prevention. Mm-hmm. Mitigation and prevention. And one of the key strategies we came up with was mindfulness. Mm-hmm. Because the classical approach to self-care is, well, have good professional boundaries, so it doesn't get to you, and you've got enough professional distance. And then when you're away from work, do whatever invigorates you, renews you, replenishes you. And if you have that sort of balance for yourself, and that's very individual. And so we respectfully acknowledge the value of that, but there are also limitations to that, especially
Right.
in the face of kind of that sort of psychic trauma that can come with vicarious traumatization. And so that's really where we brought in, there was a kind of an emerging literature on the value of mindfulness in self-care. So we really came up with what we call self-awareness-based self-care, which was a combination of self-knowledge, knowing yourself as a person, cultivating mindfulness, and that could be cultivated through mindfulness meditation or through reflective journaling. Those were the two things we really focused on. And yeah, those were really the two key things that we came up with, and also self-compassion. You know, that kind of when we start reflecting on who we are, we see that we're not maybe all we'd like to be, and can turn to self-blame or even worse. And so we need that sort of kindness coming towards ourselves too. So that was so I was putting this article together at the end of our 1 year of research. I was reviewing the symptoms of burnout, chronic physical and emotional exhaustion, a lack of personal accomplishment, meaning you just never felt you were quite doing the job you wanted to do. And the third one was kind of a sense of detachment or a little bit of cynicism, you know, coming in. And just a light went on and I realized I was burnt out.
Wow.
And what was particularly confusing to me at the time is I thought, well, I'm doing everything I'm suggesting in this article.
Yeah, I'm living my own advice here,
I'm
and
living
yet,
my advice here, and yet something's missing.
well,
because
you know, I just I didn't mean to interrupt, but you know, when you describe these things, and having worked in that environment myself, the word I ended up coming up to describe how I was starting to feel was a sense of erosion. It's subtle, like it, you know, it's a little bit every day, a little bit every day, and it's not like a blow. Occasionally there's a blow, but it's more the coping with this and taking a deep breath and going on, and then you know, and that after a while I started to realize, like, this, I'm losing pieces of myself here. Things are eroding that are critical, and it does require taking a breath in the midst of a very busy schedule to even notice that. You know, and there's all the other coping mechanisms that don't serve one well, like eating and drinking and whatever, or watching TV, and that's what people do a lot, you know, in general.
And what you're describing, Arlene, is really that self-awareness piece, you know, kind of knowing yourself well enough to kind of see what you're doing, and having enough mindfulness or self-awareness to be able to just watch it and notice it as it's happening. And the thing about that is that mindfulness then gives you space to choose, you know, whether you want to continue or...
So Michael, so you discover you're burned out. What's the next thing? Tell us how you end up writing the next book. I discover I'm burnt out, and I realize it's not because I'm not practicing good boundaries or timeouts or even mindfulness and self-awareness. I've been kind of working on that for years. What I discover is that, and your description is very good, it really resonates for me, that sense of kind of slow erosion or hemorrhaging almost of energy. What I discover is that is happening for me, and that has happened because I've been doing this at this stage for maybe 25 plus years. It's a lot of people.
It's a lot of people, it's a lot of suffering, and that it was really the kind of the slow impact of all that suffering and pain over time that I hadn't really acknowledged the toll that was taking, that I didn't really have a good way of being with my own pain, you know, because being with others in their suffering and their grief was painful.
Yes.
And I was feeling that. And
Yes.
I heard their stories day after day, many stories each day, and had to move on to the next one minutes later. But that was taking a toll on my psyche, and I needed to find another way of being with pain. And so that became a search. And that search became also the writing of a book that went on really over a 10-year period and ended up with this little book, The Nest in the Stream,
which was written at our beautiful La Casa de Maria,
Yeah,
which we no
yeah.
longer have yet. Hopefully it'll come back. Well, Michael, I know there was an excerpt that you wanted to share from the book that might give us a picture of your discovery. So I want to make sure we have time for that.
Okay, thank you, Arlene. I thought I might just read you a short little passage. The title of the book is The Nest in the Stream, Lessons from Nature on Being with Pain. So at the very core of the book is a discovery of kind of the powerful medicine of nature and specifically of nature connection. And of how nature can come towards us in amazing and healing ways when we're open and receptive to it. And so in the middle of this kind of quest for a way of being with pain, I was on a retreat at La Casa de Maria. I was actually co-leading the retreat with 2 Native American teachers. And on this particular afternoon, they sent us out and they said, just go with whatever question is on your heart and
Gotta read.
and see. I don't think I'm going to have time to read it. So
All the more reason for the audience to get the book.
I went down to the edge of a creek at La Casa de Maria, and I saw a nest in the stream, and I saw the water flowing through the nest in the stream, and I knew that nature was offering me an answer to my question, how can I be with my pain? And to understand more about that, all I can say is, please look at the book.
Well, thank you, Michael, and I think that message of the healing power of nature, we'll leave it there. I want to thank you, and we have this book called The Book of Living Love. You might want to remember one of your patients there. And I would like to thank TVSB and my crew, Elliot Jacobson and Michael Nicholson, for your support, and thank you readers, for our listeners, for watching the show. You can see other excerpts on dyingingrace.com.